Excellent presentation. It's very exciting to see everything that can be used using technology to achieve something like this. So 2 questions. Where is the money coming from to implement something like this? And what is the evaluation process to see if it's actually bringing a health cost reduction or something like that to show to the hospital, to the health network?
Yeah, I really believe, in the more I've been through as a junior doctor now as a consultant, that you need to invest a little bit if you want to save a lot. So there's a big focus on being like, we need to save money, we don't have enough. One of the things that is the way that hospitals get money, and this is why I got interested in coding, is through clinical coding. So at the moment, because we don't document very well in all hospitals around the world, here in South Australia, let's just take the Lydia cure. We don't document super well, which means the coding is not completely accurate, which means we are being underfunded for the work that we're doing. So we could be providing, and I believe that in most cases we are providing very good high quality care, as good as many other places you could go to. Statistically, it doesn't look like that because the documentation and the coding doesn't support it, and we are then being under reimbursed. So I might, for a patient, we invest in her recovery. Let's say Betty has come in with pneumonia and delirium and stuff. She stays for 7 days and again goes to rehab. Now, I might have expended $10,000 in her recovery and had good staff, good equipment, etc. She's really received good quality care and left on time. But I might only get $3,000 back from the government for her care. We're running it in a financially unsustainable way. So one of the answers is technology like CDI Engage and our documentation AI-based tools that will help fix the documentation problem, so our income will actually, for the hospital, will increase to match what we're actually doing. We're spending the money, we're just not always getting it back and recouping it. That's one thing. The other side is going, for every junior doctor that we have, we want to maximise the work that they can do. Not just junior, every doctor we have, every clinician that we have. We are spending a lot of money on trying to retain them, and then they move on and we have to hire someone new. Every time you hire someone new, you're losing money because they lose corporate knowledge. You're having to train them up. The more junior, the more that we can retain people through having really good working conditions. That's number one. People need to feel respected. They need to feel valued. They need to feel part of a team. We need to meet their individual needs for their career in our hospital networks and not treat them like it's such a privilege to work for our hospital network. In NALHN, we have an ambition, like my executive director has said this, he said, I want to increase the number of medical student and other student placements triple in the next 5 years, and I want every student who comes to NALHN to have such a great quality experience to learn and feel supported and coached and feel part of the team that they would only see NALHN as the place that they want to work when they finish because they had such a good experience and felt so valued and respected as a student. That's ambitious. I love it. I've never heard a senior doctor talk about students like that. Often students are just kind of like the flies on the walls. How lucky you are to be the fly on this hallowed wall of next hospital, literally there. And so that's another part of it, is making people feel valued. And then for each person that's there, can we invest in technology that's going to save them time and improve their work output so it's more efficient? And it's about cost modelling for that. And honestly, sometimes it's actually saying this is going to cost more, but the quality and the output will increase accordingly. So in the long term, we will have to hire less people. And if we can accept that now, our costs will be lower in the future. And you need leadership that's willing to take those risks and not just go, oh, this is a saving tomorrow of this money. This is a saving that's going to happen in 5 years. That's the kind of leadership we need.